We're going to take you live now to Sydney, where New South Wales Premier and Health Minister are giving a coronavirus update.
And really amazing to see Sydney in the community who've respected the restrictions, who've done the right thing, even though it's so hard for so many of us. Everybody has really stepped up. There have been a few disappointing examples, which Assistant Commissioner Webb from the New South Wales Police Force will discuss, but the vast majority of people have been respecting social distancing when they are out for essential issues, and otherwise they've remained in their homes doing the right thing. Can I again stress that I know that for many families across New South Wales, Easter is time when they may have gone to a place of worship, a church, or else gathered together in family homes. Unfortunately, this isn't allowed tomorrow. Can I please ask everybody to respect that? We don't want anyone unintentionally getting sick on Easter Sunday because they haven't appreciated the significance of having to really respect the restrictions. So I know this is a very different Easter for all of us, for many of us, including myself, but it's to keep the public safe, and I really want to thank the vast majority of our citizens who've done an amazing job and encourage you to continue because it's so important that occurs. I also wanted to acknowledge that in the last few days we have seen an increase in testing numbers, and we want to stress that even during the Easter days you can still get a test, you can still go to a GP. It's very safe to go to a GP or a hospital even if you have a non-COVID issue and need medical attention. Dr. Chant will elaborate on this point, but it's been noticed that less people are going to their GPs and less people are going to hospitals when they need to. So please know that if you need medical attention outside of COVID, you should get that medical attention. We don't want people ignoring their other health issues during this COVID crisis. And I just want to stress that point and say, however, during Easter, you can access medical services, whether it's to get a test, and we've seen that number go up. But however, even though we've seen the number of tests go up, we've seen the number of cases stabilise and maintain their current rates, which is very pleasing. But we're nowhere near out of the woods. The worst is yet to hit us. But the early signs are encouraging that the restrictions are having a positive impact. When we look at what we're going through in New South Wales and Australia compared to other parts of the world, we can take stock and say that we have done the right thing at the right time, and we really need to continue that. But we're always getting health advice on what that means for the future. Again, a big thank you to everybody over Easter. Please keep it up tomorrow and the day after that. We don't want to see anybody unintentionally getting the virus because they haven't stuck to the restrictions or their loved ones haven't. I know it's really hard. I'm not doing the usual things I do on this weekend with my family, and I know what it feels like for so many people across the state, and I just urge everybody to heed those warnings. And again, as Dr. Chant will elaborate, please make sure if you need to get a test, you can get that over the long weekend, but also if you need medical attention through your GP, you can also get that as well. I'll ask the Minister for Health to elaborate on today's health update, then Dr. Chant will give us an update, and then Assistant Commissioner Karen Webb will give us an indication of how well the community has done, but also highlight, unfortunately, those few exceptions when the police had to issue $5,000 fines to individuals who weren't respecting the law.
Thank you, Premier. I'd like to start by just thanking the community in what is a very challenging time. In what is a very special time for Christians, Holy Week, and of course Passover as well for Jewish people. I'd just like to thank you for your understanding, particularly as many of you would normally have been attending services. So many of you have made sure that we are complying with our social isolation, our separation of 1.5 metres each from the other. This morning as I came here, I stopped at our local chemist, and people were lined up on the pavement, all separated by 1.5 metres. We stopped at the coffee shop to grab a coffee, and they were exactly the same. So right across our great country, our great state, our great country as well, people are actually complying, so thank you. And as a result of that compliance, we are seeing a lower rate than we had anticipated at this stage, and that is fantastic. Yesterday, of course, it was 49 people who were confirmed cases to 8 p.m. the day before. And the day before that, it was 39. Today, I'm very pleased to be able to say that we're smack in the middle of that. Today, as at 8 p.m. last night, we've had 44 confirmed cases. That takes the total confirmed cases to 2,857 cases. We've had, as the Premier said, the health system and all of our emergency services are out there working to keep us all safe. And Health yesterday still did 3,515 tests. So it's amazing. That was a Good Friday. So thank you to all the staff who worked through that period. Sadly, we've had one more death, which has taken the New South Wales toll to 23 deaths. And again, on behalf of the community and on behalf of our government, I express our condolences to that person's family. It doesn't matter what the time, it's always tough when a family member passes away. And this is the toughest of times, so we're thinking of you. Dr. Chant will have more to say about those issues, particularly in relation to some of the testing that's been done. I also just want to thank the councils again. Yesterday we announced, I was here with Gerard Hayes from the Health Services Union, and he and I both expressed thanks to councils who have come on board and joined the state government's efforts to make sure that our health workers can get free car parking during this very difficult time. And the state government has made sure that health workers will have free parking during this COVID crisis, and councils have stepped up, but I'm pleased to announce too that our City of Sydney Council has also stepped up to the mark. I spoke to Lord Mayor Clover Moore, and she has confirmed that essential workers are being issued with permits to be able to park free in their car parks and at other locations around the city where it's necessary. So thank you, and I encourage all councils right across the state to take this message on. We are a community, and let's show that we can join with each other and ensure that our health workers know they're number 1, 2 and 3, along with our other essential workers, including of course the police and the border force and so on. I said yesterday it was disgusting to think that somebody would cough on a health worker or a police officer doing their job in this particular COVID time. It is absolutely remarkable that there are still people who would do that, and Assistant Commissioner Webb will tell us about 2 cases in a moment. But as Health Minister, I just want to say again, please don't behave poorly. Please don't do anything stupid. This virus is extremely dangerous. The reason why our community is doing so well is that so many in the community are looking after all of us. They're looking after themselves and they're looking after us. So even 1, 2 or 3 people who do this is just completely unacceptable. And I just ask those people who even contemplate those issues to rethink it. With that, I'd like to ask Dr. Kerry Chant to speak. Before she does, I just want to say this. Dr. Kerry Chant and her public health team have been working on this crisis now continually since about the 2nd week of January, when it really started to take control of the world. I can't tell you how much admiration I have for Dr. Kerry Chant and her public health team, but all of the health workers across this state. As Health Minister, I couldn't be prouder to work with each and every one of them, and I think if we can make sure the community are actually out there patting them on the back, not shaking hands, but patting them on the back whenever you see a health worker, whether it's a nurse, whether it's a cleaner, whether it's a security officer, or whether it's some of our most senior health staff, as with Kerry Chant, just a giant thank you to all of them. Dr. Chant.
So there's currently 212 people being treated by New South Wales Health, including 30 patients in an ICU and 23 of those that are ventilated. I also want to update you on the testing that was conducted on the Ruby Princess amongst the crew. There were a total of 88 tests that were undertaken, and those tests were undertaken on those with mild respiratory symptoms and those that were recovering from the illness on board the ship. That's identified 44 cases were positive, and those tests are not unexpected given the COVID on the ship, and I just want to stress that there's a combination of those that are recovering, and as part of our recovery process we're testing them for clearance, as well as those that have got some mild respiratory symptoms. There is action being taken and I'm pleased to say we're working cooperatively with Border Force, Aspen and New South Wales Health. There's regular conversations happening every day. There are going to be some strengthening of the infection control procedures on board the ship, and also there's going to be an external food provider to provide food and catering on the ship as an additional enhancement measure. Thank you.
Okay, there's currently a joint agency operation underway to repatriate more than 1,100 people who have now completed their 14 days quarantine at Sydney hotels. This will be an operation that remains ongoing now for a number of days. I understand the operation is going smoothly and almost more than half of those people have already left safely on their way home. Police have also been made aware that there's no cars on the road, either metropolitan or country roads, and we're very appreciative that people are listening to the messages and staying home. Operation Tortoise is still underway and double demerit points still apply. The rules around social distancing and public health not being out without a reasonable excuse still exist. And last night police arrested 2 people. One person in the Liverpool area for breaching that reasonable excuse, and as a consequence that person is alleged to spit at police officers and has been issued a court attendance notice for that offence. In a separate incident in the Port Stephens area, a man was arrested after spitting at police during a domestic violence incident. He was issued a $5,000 fine. Spitting or coughing at public officials is disgusting and against the law. It's disgusting at any time, particularly during COVID. Anything else?
Very awful circumstances.
I'm going to ask Dr. Chant to do that because she has more detail than I do today. Dr. Chant.
Certainly. In New Jeff is in a 91-year-old female with pre-existing health conditions who died in hospital. The source of her infection is unknown, and let me express my condolences to her family at this difficult time.
The Premier said that the worst is yet to come. When do you think that we'll see that?
How we navigate our way through the COVID is a point where obviously we're considering at this point. We understand that overseas there's been countries that are peaking and we're watching the growth of cases in other countries. Our approach has been to buy us time to get our health system prepared and to also make sure that we've got those essential tools that we'll need to tackle COVID-19 ahead of time. And that relates to having supplies of testing kits and using new innovative testing kits that allow us to do the testing faster and quicker, to scale our public health contact tracing facilities. But these are all matters that are under consideration as we look at what is happening around the world, as well as also share some of the scientific advances about treatments and vaccines, and have those discussions with the community around the course ahead of us.
Have you been able to read the article in today's Australian Paul Kelly Chief Medical Officer saying that COVID, we may be killing off here in the country, so contradicting what you're saying now, that the numbers are decreasing. Winter would be the worst of it, but I don't know if you've had a chance to read that.
Dr. Kelly, we spend lots of time talking with Dr. Kelly. Dr. Kelly's the Deputy Chief Medical Officer at the Commonwealth. There's actually a teleconference at the moment where we get together and discuss the situation, as well as emerging information overseas, as well as learning from countries, both what they've done well and what they've done not so well, to inform our response and to provide the best health advice we can to governments. That we are reviewing and meeting daily. We didn't meet yesterday, but we'll be meeting every day of Easter long weekend. No, I'm not saying at all. I'm saying that we are currently seeing low rates of suppressed transmission in the community, and that's pleasing. But in the end, we've got to look at when will a vaccine be available, how we will navigate our role through that, where is the optimum settings. As the Premier's indicated, we're currently considering what the position in relation to school will be in term 2. This is going to be a long journey, and we need to, the strategies that have been put in place in Australia, we should be incredibly pleased with the outcomes. It has bought us time to reflect on how we're going to navigate the journey ahead.
What kind of an app that would actually train people
health contact tracing, which involves identifying cases rapidly, isolating those cases, and then rapidly getting to their close contacts. Is it really effective? And that's been one of the key things that we've done really well in Australia. Obviously, if there's technologies that can assist us in that, particularly when we get more cases, or if we get more cases, of course we're considering all strategies. We're looking overseas, we're looking at the Singapore experience and other countries. So this is actually part of our response, is being very reflective of what other technology is available and what is in place in other countries and what's worked well.